is LBC. From Global, leading Britain's conversation, The Nigel Farage Show.
Mr. Nigel Farage.
Thank you, Donald. Well, the Downing Street press conference today ran a little bit over time, but that wasn't where the action was today. No, the action today was in the House of Commons. We've commented over the last couple of weeks that Sir Keir Starmer had made a pretty solid start as Leader of the Opposition in the House of Commons. And today there was an exchange between Boris Johnson and Sir Keir Starmer that I think was significant. It has led to a row this afternoon with Sir Keir Starmer demanding Boris Johnson comes back to the House of Commons. Boris Johnson accusing Keir Starmer of being misleading. Let's listen to that exchange at lunchtime today.
Mr. Speaker, in a speech on Sunday, the Prime Minister said that we need to rapidly reverse the awful epidemic in our care homes. But earlier this year, and until the 12th of March, the government's own official advice was, and I'm quoting from it, it remains very unlikely that people receiving care in a care home will become infected. Yesterday's ONS figures showed that at least 40% of all deaths from COVID-19 were in care homes. Does the Prime Minister accept that the government was too slow to protect people in care homes?
Prime Minister.
No, Mr. Speaker, it wasn't true that the advice said that. And actually, we brought the lockdown in care homes ahead of the general lockdown. And what we've seen is a concerted action plan to tackle what has unquestionably been an appalling epidemic in care homes, and a huge exercise in testing is going on. A further £600 million I can announce today for infection control in care homes. And yes, it is absolutely true that the number of casualties has been too high, but I can tell the House, as I told the Honourable Gentleman, last week and indeed this week, the number of outbreaks is down and the number of fatalities in care homes is now well down. There is much more to do, but we are making progress, Mr. Speaker.
Keir Starmer.
Mr. Speaker, I'm surprised the Prime Minister queries the advice of his own government up till the 12th of March. I do, of course, welcome any fall in the recorded numbers, and he's right to reference that. But the Prime Minister must still recognise the numbers are still very high.
Well, the numbers are very high, and we are dealing here with 10,000 unexplained deaths in care homes. And this is a very serious matter indeed. Was Sir Keir Starmer right in what the government advice was up until the 12th of March, or is Boris right in his response? Well, joining me, somebody who's been following this all day, is Ben Kentish, LBC's Westminster correspondent. Ben, lively exchanges. Just talk LBC listeners through the sequence of events after that exchange.
Well, Nigel, Boris Johnson denying that what Keir Starmer had claimed was in the document. Labour, very surprised by that, wrote within minutes to the Prime Minister asking him to apologise, saying he had misled the House of Commons, and also pointing people towards the document. Now, before we go any further, let me just read out what Keir Starmer says very briefly. He said this is what he said the document said. It remains very likely that people receiving care in a care home will become infected. Now, let me just read what the document does in fact say. It remains very unlikely that people receiving care in a care home or the community will become infected. It is word for word the same. So that was Labour's point. Number 10 then hit back, accusing Starmer of quoting misleadingly and selectively from that document, because they said he hadn't mentioned that elsewhere in the document it makes clear that that advice only applies at that time. The document says somewhere else.
But isn't this the key,
current
Ben?
Position in the UK.
Isn't this the key, Ben? That Starmer said,
Nigel,
Starmer said up until the 12th of March.
Yes, and that was when the advice was withdrawn. So the advice, there's no doubt, the advice up until the 12th of March was that there was virtually no risk to people in care homes. And the point that the Labour leader was making was that at that point there very clearly was a risk to people in care homes because there were many cases in the UK, and people in care homes should have been getting ready rather than being told there was no risk. Now, one other point on this, Nigel. Asked about this tonight at the press conference, the Deputy Chief Medical Officer said the advice stayed in place that long. It was issued on the 25th of February. It was only withdrawn on the 13th of March because at that time they had made the decision, they had the view that there was no sustained community transmission in the UK. Now, you might think, fair enough. Listen to this. Minutes from a subcommittee of SAGE that I am reading now say this. There is a realistic probability that there is already sustained transmission in the UK or that it will become established in the coming weeks. The date of that, Nigel? The 10th of February, 2 weeks before the guidance was even issued and more than a month before it was withdrawn.
No, well, that's a very good piece of work on your behalf. And so, basically, there's no denying that up until the 12th of March, that is what government advice said, and then it changed. Why? Oh, why, oh, why? Given the facts of this are perfectly clear, did Downing Street hit back, say that it's all been quoted out of context, and even more remarkably, Boris Johnson writing to Keir Starmer, I would remind you of the commitment you made when you became leader of the opposition to work constructively with the government. I mean, it's as if, there's an old maxim, when in the hole stop digging. Is that what Boris is doing?
Well, I think it's probably fair to assume, Nigel, that they are trying to turn the row into one about Keir Starmer criticising the government. But then, of course, he is the leader of the opposition. And he would say, well, we can work constructively, but that will also include pointing out constructively where we think you've got things wrong. And I have to say, it is not just opposition politicians who are of the view that things have gone badly wrong in the care sector. We talked last week about here, even members of SAGE, the government's own scientific advisors, have said to me for many weeks, this is the heart of the issue. It's still not being addressed properly, and we were too slow to start with. Now, ministers say they have now got the measures in place. They're announcing 600 million more today, that they are doing all they can. But you can be doing all you can now, of course, while there's still being a criticism, perhaps, that you didn't do it earlier.
Yeah, no, absolutely. And Ben, at the 5 p.m. Press briefing, were journalists honed in on this point?
Yes, it was the issue that dominated the discussion, really, Nigel. I think it's the issue that's going to dominate for some time to come, because it's clear that care homes are now where this epidemic is spreading. Care homes and hospitals, again, that was something that SAGE members were keen to emphasise to me last week. 40% or so of deaths have come in care homes, we believe. And also, of course, these are the most vulnerable people in society, really. Some of the most at risk from this awful disease, and some of those who might have expected the best protection. Now, the government might say, well, other countries have had a similar proportion of deaths in care homes. It's not just us. And that is true to an extent. I think it's about 45% in Italy. So there are international trends on this too. But the focus in the UK is going to be on whether too much focus early on was on the NHS.
Absolutely.
And whether the issue in care homes was only addressed when it was really a bit too late.
Yeah, the Cinderella. Absolutely. Ben, thank you very much indeed. So, I'm going to debate tonight with you. Given there are 10,000 unexplained deaths in our care homes, is Boris Johnson in trouble over this? 0345 6060 973. You can text to 84850 or tweet using the hashtag Farage and LBC at LBC. I have to say, I think Boris Johnson is in a bit of trouble over this. Why? Well, I've said before in the last couple of weeks that Keir Starmer is very forensic in his style, and indeed he is. I said in previous exchanges he'd had a points win, but no knockouts. Today, he came a bit closer. He has riled the Prime Minister into giving an answer, not just in the House of Commons, but also in his letter to Keir Starmer, that is, bang to rights, factually inaccurate. Now, you might argue, does this really matter or doesn't it? But it might be easier. It might have been easier for Boris to say, yes, actually, that was the advice up until the 12th of March, and then it changed when we realised there was a bigger risk with this spreading within our care homes. They haven't done that. And what that means is that Keir Starmer will now be like a dog with a bone, and the debate will move on. And I'll tell you where it'll go. It'll go to the fact that people who were diagnosed positive with COVID-19 were sent from hospitals to care homes. Now, some of them maybe had been in hospital a couple of weeks and would by that time not have been contagious. But I certainly know myself of examples of people being sent from hospital to care homes who were contagious, with the care homes not even being told until the patient had already arrived. And I think this is perhaps going to lead to the biggest scandal of this crisis. And you ask yourself, is it all Boris Johnson's fault? Well, actually, no. He doesn't run the day-to-day management of every single hospital, every trust, or indeed the actions of Public Health England. Yes, sure, he's the guy at the top. But at some point, we're going to need some contrition. At some point, we're going to need some honesty. And as I say, I'm quite happy for Boris to say there are hospitals that made terrible mistakes. Public Health England got the advice wrong. But at the moment, he can't be seen, he thinks, politically, to criticise the NHS. And I'm not criticising the men and women that work in the front lines, but something has gone badly wrong here. And by not accepting that Keir Starmer got this right, he has now led this into a new place where there is going to be a massive row and debate about, as I called it already, the Cinderella care homes. You tell me, is Boris Johnson in trouble over this, given there are 10,000 unexplained deaths in our care homes? I really think he is. Let me know. 0345 60 60 973. This is not just a war of words between Boris Johnson and Sir Keir Starmer. This is an issue in which there are 10,000 unexplained deaths in our care homes. So it is a matter of the utmost gravity. Now, those that criticise Keir Starmer say, oh, well, he's backtracking. He's talking about what was said then. What Keir Starmer is doing is saying to the government, and this is a theme he's been working on, weren't you a bit slow on all this? Weren't you a bit slow in bringing in lockdown? Weren't you slow to recognise the risk to care homes? And Johnson insists that they weren't. On the fine point of what the advice was up until the 12th of March, which was what Keir Starmer said in the House of Commons, there is no doubt in my mind Starmer is right and Boris Johnson's team are blustering, but they're actually wrong. And I'm asking you, is Boris in trouble? And I think he is, because I think this then leads into a bigger debate about care homes and a bigger debate about why people were being sent back from hospitals to care homes, in many cases carrying this disease. Let us start with Colin in Bromley, who's a new caller. Good evening, Colin.
Hi, Nigel.
Good evening. So,
right, I've got a big opinion on this because I've got personal experience of it.
Okay.
But the 10,000 deaths are coming from those who had their right to health and their right to care taken off them. It's all the people with cancer and on dialysis that had their care removed.
So is the argument, Colin, that many of them would have gone into hospital normally for dialysis treatment, for argument's sake?
Yes, and because they didn't, and cancer as well, because they didn't, these people have ended up dying. But obviously, Boris does not want that out there so that everybody knows.
Isn't it a bit of both, Colin? I mean, look, I absolutely accept that you're right, you know, and when we know in this country that 50% of acute cardiac cases have not been seen in the last 7 weeks, your point is absolutely true. But equally, there are care homes in which coronavirus has absolutely ripped through and killed a large number of people too.
Yes, absolutely, because he took them out of hospital to put them there to make the beds available.
But that isn't Boris's fault himself, is it?
Of course it is. It was his directive. My own doctor has accepted that and written a letter about it to me to explain to me why I can't have my lungs looked at, and there's issues with my lungs.
Mm.
And it's because of the directive of the government that says she can't, because she has to look after the virus patients first.
So who takes the blame? Is it Matt Hancock? Is it Boris Johnson? Is it...
It's Boris. End of story.
What, because he is...
Because he's in charge, he's making the decisions, he's accepting what everybody tells him, therefore he's the one to blame.
All right, Colin, you feel very strongly about this, and I can tell why, obviously. Is it... Do you think this is one of those arguments that disappears by this time tomorrow? Or do you think Starmer has put Boris in a place where potentially he's in a bit of trouble?
I hope it keeps him in that place, so he keeps asking him until he actually gets the answer that Boris accepts the fact that he did wrong.
OK, Colin, you could not have been clearer with that call. Jan is calling from the Wirral. Jan, good evening.
Hello, good evening to you, Nigel. I did speak to you about a week ago
I remember.
about situations in care homes.
I know, and that's why we're keen to have you back on, Jan. Yeah.
Yeah, well, Mum has now sadly passed away.
I'm sorry.
And,
I'm sorry.
we're having, obviously, conversations with the care home and funeral directors. Mum's GP has put her death down on the death certificate as Parkinson's disease, which she did have. I've never seen anyone die of Parkinson's disease that quickly. To go from 1 week, whilst socially distancing, took a piece of paper in to get the staff, to get Mummy to actually sign it herself for her pension, what have you. And she was pretty much fine then. And to be dead a week later, I don't think that's that. And I've gone from seeing the staff wearing no PPE at all whilst dealing with Mum to within a week, all, I've been gloved up and what have you for weeks now, to then being masked, aproned and gloved up in order to just go into my mum's room. So I'm not really inclined to believe that it was Parkinson's, and I just think it's a way of, should we say, massaging the figures.
Well, we've got 10,000 unexplained deaths. Clearly your mother was not tested at any point in time.
No, and it's too late for that to happen now,
Yes.
although the funeral director yesterday, when my sister asked if she could go and see Mum in the funeral director, the Chapel of Rest, he said, well, we don't know that she didn't have COVID, so it's a bit of a risk, and we're not encouraging people to do that.
And I mean, obviously, Jan, you're going through your own family grieving at this moment on this, but do you feel...
That's why I'm being polite.
I know, I can tell you're being very, very polite, and I'm going to ask you a question which you haven't got to answer, because it may not be appropriate. But do you feel there's some element of blame for what has happened here in care homes?
Yeah, I mean, most of the blame really is with China, because that's where this all started.
Right.
And we absolutely need to remember that this is the Chinese making.
Well, it may not have been deliberate, Jan, but anyway, yeah.
Well, no, I'm not saying it was deliberate. It might have been accidental, but that's where this disease came from. I do feel I can't say that my mum died from COVID-19. I can't, and I'll never know the answer to that.
But you'll always think it, won't you?
Yeah, absolutely.
Yeah,
and there's no way that I'm ever going to know.
Jan, thank you for coming back and talking to us again. And I'm very sorry for you and your family. Thank you for sharing that with us here on LBC. So there are 10,000 unexplained deaths. Maybe you've just heard an explanation for one of them. I don't know. I'm not a doctor, but it does sound a bit like it. Let's go to Redditch and speak to Irene, a new caller. Irene, good evening.
Good evening. I'm very sorry for that lady losing her mum. I know how I felt when my mum died.
Yes,
but I am absolutely furious with Keir Starmer.
Okay.
He's trying to politicise it all, and he promised that he wouldn't.
Well, hang on.
It's got nothing to do with Boris, who gets sent to the care homes. If he wants to go after somebody, he should go after the people in charge at the NHS.
Yes, I agree.
They're the ones who make the policy decisions.
Irene, I agree. There have clearly been some very bad mistakes made here. But Boris won't ever say that, because the polling says the British public love the NHS, and that's why...
Well, it's about time they opened their eyes.
Well, I think...
The doctors and the nurses are wonderful, but the people that run it are a joke.
Irene,
My daughter-in-law's just recovered from this virus, which she picked up working in the care home, because they were sending people back to her care home that had got it.
Yeah. This is, Irene, this is the great scandal, isn't it? The great scandal is that we've actually ourselves, within our own health system, pushed the spread of this from hospitals into care homes. No, Irene, Boris, either, he's got a choice, hasn't he? Either he takes full responsibility and owns up to what has happened, that he can't get away with it the way it is today, or someone blames the NHS. But Sir Keir won't blame the NHS, and Boris won't blame the NHS, because, Irene, as Nigel Lawson once said, the NHS is the nearest thing we have to a state religion.
Absolutely.
You know?
But I think it's dreadful what they've done. I'm so disgusted with them.
Yeah, it's a very powerful point. Irene, thank you. Off to Kingston to speak to Kelly. Kelly, good evening.
Yes. Hi, Nigel.
Hi.
No, I don't blame Keir Starmer at all. I think it's just opened our eyes to what we already knew. And it was all hidden and it wasn't talked about, but thank God someone's brought it to the forefront.
Yes, and I think now that it's out there, Kelly, I think we're going to see a lot more of it. And I think...
Yeah, of course.
I think this whole story of people being sent from hospitals into care homes who were coronavirus positive, I think this is going to be an almighty round, isn't she?
Yeah, I do. And I think Keir Starmer has opened an envelope, if you like, and it's all going to pour out from now.
Do you know
and
what,
thank
Kelly?
God he did, because
Do you know what,
it's all
Kelly?
been hidden.
Do you know what, Kelly? I absolutely agree with you. I think if Johnson had answered this honestly, now, at the time, in the House of Commons, he may not have been on top of the fact. Everyone says Boris doesn't do detail. But to fire back with this letter, denying what clearly in factual terms was true, is a mistake. And I think he's going to make it worse for himself. When in the hole, stop digging. Kelly, thank you for your call on Twitter. I've never heard such a terrible answer in response to the question regarding excess deaths in care homes. On Twitter, I think Keir Starmer will be wrong not to point out things when they've gone wrong. Boris will have to look out as the truth will be told. Angela says, go Sir Keir. Yeah, and this, responds in very much in a way to Johnson saying to Starmer, well, you promised we'd work together. Yeah, but criticism is fair at all times, provided it's justified. Nigel, lockdown did not start earlier in care homes. I saw my mum on Mother's Day, which was the day before general lockdown began, says Sandra in Loughton. Sandra, you're absolutely right. Mother's Day was the 22nd of March. Nigel, I don't really care for hindsight Starmer. Boris Johnson's got enough on his plate without all this left-wing carping. Starmer's been asking for an exit plan for weeks. When he gets one, he says, why are we coming out of lockdown? The public don't like this, says Gareth in Doncaster. Gareth, who you like and don't like, I don't think is the issue right now. There was a factual exchange in the House of Commons and letters afterwards, and there's no doubt on the absolute specifics of what the advice was. Up until March the 12th, Starmer is right, and Boris is trying to bluff it away, hoping it will go away, and I think he's made a mistake, and I think he's in a little bit of trouble. Well, the big row between Boris and Keir Starmer is not the only news of the day. Another 494 people who tested positive for COVID-19 have died, taking the government figure to 33,186, although ONS will tell us that it is in fact over 40,000. Boris says death tolls in countries around the world are no longer relevant and will not be released by Downing Street because it's premature to compare them. This having shown a graph every single day since March the 30th that did compare death rates in this country with the rest of the world. Transport for London said that today, Wednesday, a day of a slight opening up, that traffic on the tube by 10 a.m. this morning was up 7.3% compared to this time last week. The manager of Waterloo railway station saying that traffic this morning coming in, passenger traffic coming into Waterloo was 45% of a normal day, which if you think about it is really quite a lot. And police in England have said they simply don't have the powers to enforce social distancing of 2 metres. So what they will do is advise people to stay 2 metres apart. But it's going to be very difficult, because if Waterloo is running at 45% and if more people are coming into London on the Underground, it's virtually impossible in many situations to stay 2 metres apart. Talking of the police, I had a nice phone call today from a senior policeman in Kent to say that I'd done nothing wrong at all by visiting Dover and making that film I did about what's going on in the English Channel. I'm pleased about that. And YouGov putting out some polling today saying 65% of Brits say the government's message on easing out of lockdown is unclear. 33% saying that it is clear. So back to care homes. 10,000 unexplained deaths. Sir Keir saying that the official advice that we were given up until the 12th of March basically said there was no great risk of this spreading in care homes. And Boris Johnson said, actually, that's not the case. Lockdown started earlier. That's the basis of the row. And I'm asking whether, as a result of this debate and where it might go, Boris is in some trouble. Now, look, this is a deadly serious subject, but our next caller is somebody who one evening in Cardiff a few years ago, batting at number 11 for England, fending off, I think, for the last 11 overs and giving us a great draw, was Monty Panesar. Monty, good evening and welcome.
Good evening. Yeah, thank you for having me on the show.
Not one bit. I'm sorry to remind you of Cardiff, but it was a remarkable thing and I loved every minute of it. Monty, how do you feel this debate's going to go about care homes and 10,000 unexplained deaths?
Yeah, I think Boris kind of neglected, the care homes and the hospices, with PPE kits, and he kind of focused on making sure that, the NHS, wasn't overwhelmed, and because that's, one of our sort of, this country's, symbols, the NHS. But I think he needs to, find an explanation of, why he didn't help the care homes and the hospices as well. And I think, I think, what Boris is doing, he's gradually putting the responsibility on the people now. He's kind of saying that, sorry guys, but he's shifting the responsibility of this COVID virus from the government, to the people.
Well, but overall, of course, if we get a reoccurrence and if infection rates go up, I agree, Monty, it'll be our fault, won't it? We won't have taken the advice. But in this case, it's more difficult for him to do so. Is there a personal reason why you feel so strongly on this, Monty?
Well, I think, one of my good friends, Devon Malcolm, his father kind of passed away in one of the care homes as well. And then I started to, obviously, when something like that happens, you kind of look into more detail of why aren't the care homes getting the PPE kits, why aren't they getting sufficient, equipment there? When then I've been in touch with some of the PPE companies as well, and they said we've got physical stock in the UK, but we just can't get it to the government. Can you maybe help us get it to the government? Find a government contact that could buy these PPE kits from us and give it to the care homes. And that's the bit I've kind of felt a little bit disappointed at, thinking there is stock available in the UK to help care homes.
The other mystery to me, Monty, absolute mystery, is 3.5 weeks ago we were told that Lord Dayton, and he's the guy that was seen to have overseen the London Olympics and the great success that they were, that Lord Dayton was being put in charge of PPE, rather like Lord Beaverbrook was in 1940 of aircraft production. And here's the odd thing. You get a guy with a big CV, you're told he's in charge of PPE, we haven't heard a word from him. It's all very odd, isn't it?
Yeah, it is. It's all a little bit. I think the government are sort of backpedaling a little bit. I think they're playing catch up with everyone else. You look at the likes of Spain and Italy and some of the other borders. They closed their borders down as well, and you kind of think why didn't the government close this down when they had their lockout? Just to control the virus. It just feels like whatever the other nations are doing, they're sort of playing catch up to that. And
too little, too late. Too little, too late.
Yeah.
Do you know that? Go on.
It'd be interesting to know, what would you do in this situation, or what would you have done?
Monty, I was screaming for lockdown to happen earlier, right? Because I was seeing what was happening in Italy. I was reporting about it every day here on LBC, and that 3 or 4 day dither that we had before when we knew it was coming, and voluntarily some of us were doing it, but that 3 or 4 day dither, during that period, infection rates doubled in the United Kingdom. So I think that was a mistake, and I think that to have allowed 18 million passengers into our airports from all over the world, with only 273 of them being quarantined, I think these were huge mistakes. Look, I'm not pretending that this has been easy. It's an unprecedented thing. But I think Boris's mistake today was not to accept that what Keir Starmer said was true, but to try and bluff it all away. And I think that means he's going to have a very difficult couple of weeks.
Yeah, because I think, the next 2 to 3 weeks is going to be crucial to him, his government, and also some people are even saying, if we have a second outbreak, then potentially it could lead to him actually not being the Prime Minister, because they may think he's not making, strong enough decisions. And
maybe what he ought to do, Monty, is rather like a cricket captain who's losing, sack a couple of players, and maybe what he needs to do is to sack Hancock or somebody else. Monty, thanks ever so much for joining us. Do call us again when you feel strongly on something. Thank you. That was Monty Panesar. Now, Jan says to me from Archway, those already in care homes when they became infected. Right, okay. She says the government barred visitors very early from coming into care homes. Well, but we just heard of a case where somebody went to see their mum on Mother's Day. And here's the other problem, Jan, that's not been talked about tonight so far, and it's this. A lot of care homes relying on agency workers. And agency workers going from care home to care home. Again, and that is something you can't blame on the NHS. That is something you can blame on care homes themselves. But somewhere here, there are managers in the National Health Service, and I don't even care whether they were told by government this is what they had to do. But if they knowingly sent people back, which we know they did, back into care homes who were COVID-19 positive, I think that's an absolute scandal, personally. We're going to Birmingham to speak to Mike, who's a new caller. Mike, good evening.
Yeah, good evening, Nigel. Thank you very much. Been trying to talk to you for ages.
Good, well, you're here. You're on the show. LBC, The floor is yours.
Right, thank you very much. It's just a couple of points I'd like to make about these discharges from hospital back to the care home.
Yes.
Okay. Now, if a patient is being discharged from a hospital, there are strict guidelines on what you do when you discharge them. But either they come from one hospital or to be accepted to another hospital. Even if they've got MRSA positive, or they're MRSA negative, they are coming from another hospital into your care. Mm-hmm. Now, either they get put into a side room and be treated as a positive case, so they're separated from any other patients within the hospital, so nobody else can get it. Mm-hmm. The same as going from a hospital to a nursing home. Somebody at that nursing home has got to have a clinically decision from someone in that nursing home who will accept that patient and then isolate them.
Well, that's fine, Mike, but the example that I was talking about was where a patient was returned from a hospital to a care home, and the care home were then told an hour after the person had got back that they tested positive for COVID-19. I mean, that is just negligence, isn't it?
That is absolute negligence, yes. That is definitely, I quite agree with you with that. But you can't put this on Mr. Johnson to say it's his fault entirely.
Mike, I'm not trying to. I'm making the point, he doesn't micromanage everything, but if it's not his fault, it must be somebody's, Mike, and Boris seems reluctant to say so.
Yeah, but I mean, someone, even if they'd have been there in an hour, they should have isolated that person straight away, immediately. And then those people they came into contact with should have been tested.
How do you feel, Mike?
I've just got a question about these nursing home managers, like you said just previously, that they are responsible for those homes. And also, a lot of those homes are actually privately owned.
Yes, they are.
Where are they? Where did they get their PPE from in the first place? It wouldn't be from an NHS provider. So why are they now going on about, I haven't got the PPE, I haven't got this? And
well, they're privately, they're privately owned, Mike, most of them, but many of the people in them are being paid for by local authorities. So it's a strange mix, it's a strange hybrid. Mike, overall, how do you assess Boris's handling of the crisis so far?
I think he's done a brilliant job, to be honest, under very difficult circumstances, because we didn't know anything about this virus in the first place. It's new, it's hit everybody, and it doesn't matter who would have been in government at the time, it would have hit them as well. And to be fair, I think the Treasury, I think the Chancellor, I think Boris has handled it well, even though he's been ill. He's in a very, very difficult situation. You're damned if you do, and you're damned if you don't.
So why didn't he? I mean, fine, and there are people that will agree with you, Mike, on this, that people think he's handled it badly. I think the government haven't done very well, but you think that he's done a good job. But why not admit that Keir Starmer was right on the point that he raised on the floor of the House of Commons this morning?
It probably was, because the actual evidence is there for it to be. It was actually in black and white on the.
So why deny it, Mike?
I'm not denying that.
Why did Boris deny it?
I don't know.
No.
I think he's been ill-advised, probably.
Well, he shouldn't need advice. He's the governor. Mike, thank you. Care homes have been neglected for years and years by all political stripes. This is a catastrophe that was inevitable during a pandemic. It's not Boris's fault personally. It's the fault of every single politician, says Karen in Red Ruth. Have to say, I've been advocating for nearly 10 years that having a separation of the National Health Service and the care sector has been a mistake, doesn't lead to joined-up thinking and actions, and maybe we're seeing a little bit of that too. This is not only a health crisis, of course, it's also an economic crisis, and we had the furlough announcement yesterday from Rishi Sunak, and this morning, a remarkably frank, I thought, interview with the Chancellor of the Exchequer, and this was after figures for the first quarter GDP were released, which showed the British economy had shrunk by 2%. The French economy had shrunk by 5.8%. Many other European countries had shrunk by more than us. And the reason was they went into lockdown or economic deep freeze earlier than we did. But here was Sunak talking about the chances of a significant recession.
Technically, a recession is defined as 2 quarters of negative GDP. We've now had one. The first quarter was that bad based on just a few days of the impact of coronavirus in March. So, yes, it is now very likely that the UK is facing a significant recession at the moment and this year.
Significant recession, says the Chancellor of the Exchequer. Now, that is good, straight talking honesty, not trying to pretend things are different to what they are. I felt Boris Johnson today in the House of Commons wasn't on top of the detail. Keir Starmer, the former barrister, director of public prosecutions, in a very lawyerly way, was. But if you've been caught out on a fact, a detail, sometimes it's better to say, do you know what, hands up, I made a mistake on that. By trying to deny it, by trying to bat away Starmer, by saying that he's been, quoting selectively and misleadingly, I think he's made this worse, and I think the whole care home row is going to get worse. Now, whether some of the mistakes that have been made here are Boris's fault, or Hancock's fault, or NHS managers' fault, or some care home manager's fault, I don't think's the issue. He is the Prime Minister. Someone has to take a bit of blame here somewhere, it seems to me. Let us go to Vish, a new caller from Braintree. Good evening.
Hi, Nigel. How you doing?
I'm doing okay, but I'm just a bit surprised that Boris didn't say, do you know what, we got that wrong.
Yeah, but Nigel, it's damned if you do and damned if you don't. I'm with you. I personally think lockdown should have happened a lot earlier. Mm-hmm. I understand why the government done it, because obviously the economy would have been a major a thought in their process. Had we have done it earlier, these same people, and kept the numbers down, these same people that are moaning now that we locked down too late would have been complaining now, saying, no, we locked down too early, and had we been showing a 5%.
I don't agree. I don't agree, Vish. I don't agree. Because here's the problem. Dithering for those 4 days or whatever it was over lockdown, infection rates doubled in that time.
Yeah, but had we have locked down earlier than that, when China locked down, when we knew there was a big issue in Italy, maybe a week, 2 weeks before they actually locked down, then, those same people that were crying lockdown, you're saying 4 days, but those same people would have still been crying. Well, and in regards to the NHS, my father was in the hospital 2-3 weeks before the lockdown happened because he had a fall, and he was waiting for a bed to be delivered at home. Now, do I blame Boris? Because as soon as that bed was delivered at my mother's house, they sent him home, and on these discharge papers it was written he's infected with COVID-19. So who do I blame for making that decision? Do I blame Boris, or do I blame the managers that made that decision?
No, I get that. I completely get that point.
And it's only after his carer came to the house 2-3 days later that he said, why is he here? He shouldn't be here. He should be back at the hospital. And she had to argue and fight with the ambulance and the hospital to take him back. But 3 days later, he passed away. But they put my mum at risk as well.
Of course. But Vish, if you're at the head, right? you are in charge. And, you know, whether it's this crisis or a war or whatever it is, if there are people that let you down, do you know what you do, Vish? You sack a general or sack a couple of generals.
Hold them to task, but look, now is not the time to hold them to task.
Well, no. I couldn't disagree more. Now is the time.
And it just shows how slimy and slippery Keir Starmer is. As a solicitor, as a barrister, you can never trust them.
Is he wrong? Is Starmer wrong?
I think no. He's not wrong to hold the government to task, but I think the timing is wrong.
Vish, I don't agree with you. I know there is this argument that in a national crisis we should all work together, right? I know this argument. But look, you know, Churchill sacked generals during World War II who weren't doing the job properly.
So then Boris should sack these managers.
Boris should sack somebody. Whether it's Hancock...
He should start holding people to task.
Yes. No, Vish, I wish he would.
This for you.
I wish he would. I really wish he would. But at the moment, no one gets blamed, no one gets sacked, and we get this daily diet of we took all the right decisions at the right time. It's just not right, is it?
Well, you know what, I think after when we do come out of this, Nigel, and I believe we do, if people's heads don't roll for this, I voted Conservative because I wanted something that I voted for to be honoured, and I thought that the Conservative Party was the only party to do it. I would have voted Brexit, but obviously you done what you had to do to make sure, you know, the right party won
to make sure Labour didn't win and Boris did. Yeah, absolutely.
Yeah, exactly. Because I could never have voted for Jeremy Corbyn. I mean, look, my family voted Labour all its life, right? And we've come from a working class family. We work to improve ourselves, not for handouts, not to give handouts, but to work to better ourselves.
Sure.
So I can buy the nice car, so I can buy the nice house. I don't educate my kids, and so in that sense, I voted for Boris, and also because of the Brexit vote. And I just want to thank you and say thank you to you for Watford. And you gave me the honour of having a selfie with you when you came there to talk.
Oh, very good, Vish. Excellent. Listen, thank you for your call, mate, and thank you for your kind words. I'm a social worker. Why don't these wealthy private homeowners pay out and protect their staff and their environment? Susan from Kingston. Susan, I'm sure some people running care homes are very rich. I'm sure some people running care homes are not very rich at all and find it quite tough. Either way, whatever they'd done, if they were being sent back people from hospital who had tested positive or who had not been tested at all, because until the 15th of April, not everybody that was sent back had been tested, believe it or believe it not. So, yeah, I do get we're looking where to pin the blame. But at the moment, Boris is denying what was clearly there in black and white. The care home route is going to get bigger. I'm asking you, is he potentially in some trouble over this? Let's go to Steve in Southport, a new caller. Good evening, Steve.
Hi, Nigel. How are you?
I'm okay, but I think Starmer has done well for himself today.
To tell you the truth, I've not really heard much today. I've only just finished work and I've only just left a care home in Southport now as a manager. I work for a small company and my owners have been absolutely outstanding over the last few months. We've had everything we've asked for. PPE has been delivered. Yeah, anything I've got. One thing I had a problem with, we had a client who went into hospital during the lockdown. 2 weeks later, was ready to discharge. I received a phone call from the hospital saying that they're ready for discharge. And I asked the question, have they been tested for COVID-19? I was guaranteed that they had. So I said, well, look, I can tell you now, they won't come through my door until I've seen some evidence that they've been tested. She went away and came back and said, apologised, he hadn't been tested.
Yeah,
and if I hadn't just stuck in there and said, look, I'm not taking him back without a test, he probably could have come back. Luckily enough, he did come back negative.
Steve, it wasn't until the 15th of April that it was guaranteed people would be tested before they were sent back. But your case, you were sharp-eyed, you asked the right questions. But what about the cases where people who tested positive were sent back? Shouldn't they just have been put into isolation in hospitals?
They shouldn't have been sent back, pure and simple.
Why? But Steve, you're in the health. Explain to us. You work in this sector. Why were they sent back?
Ask the hospitals.
Right. So
to do with the care. At the end of the day, the care homes.
No, I get that.
Sometimes are being forced.
No, I get that. I get that. So is it Boris's fault, this mess, or is it governors in the NHS?
It's going to be the NHS. At the end of the day, Boris doesn't deal with the NHS, and he doesn't deal direct. When clients are being sent home from hospitals, they should be informing the homes what's going on.
Well, someone's got to take responsibility somewhere. At the moment, it's Boris who's going to get a lot of stick over this. Starmer did have a good day today. I'm back tomorrow at 6. At 10 tonight, it's Tom Swarbrick. Right now, it's Ian Dale.